I'm Dr. Erin Yelland for K-State Research and Extension. Have you ever thought about the medical care you would like to receive if you were to become incapacitated due to illness or injury? Have you thought about who you would like to make those medical decisions for you if you weren't able to make them for yourself? That's what we're going to be talking about today, advanced healthcare planning in Kansas. I always like to start off this segment by sharing some stories with you. Many of you may have stories that have happened in your own life or in a friend of the family. The first story I'd like to share is of a friend of my own family who had Alzheimer's disease for many years. Unfortunately, she was left in a long-term care facility, was on artificial nutrition and hydration, life support, and all these sort of things that were prolonging her life unnecessarily. Because she didn't have her advanced directives in place, this could have been prevented had she completed those documents. Another story is one that many people will recognize and occurred back in the 1990s. A 27-year-old woman from Florida suffered cardiac arrest and had severe oxygen deprivation to her brain. She was left in a persistent vegetative state, and her husband and family members fought in the courts over her right to die for 15 years. Many of you might be automatically recognizing that story as that of Terri Schiavo's. She was the first right to die case that really brought to light and national attention to the need for advanced directives and advanced healthcare planning. Despite the stories that you've heard today and the recollection of Terri Schiavo's case, many Americans still have not completed their advanced directives. Less than 1 in 4 American adults have completed those forms, such as the durable power of attorney for healthcare and living will. The number one reason why individuals have not completed those forms is a lack of understanding or a lack of awareness about the forms and how to complete them. So you're taking the first step today by watching this and understanding what those forms are and how to complete them. So I've already mentioned that advanced directives are those forms like the durable power of attorney for healthcare and living will. But overall, advanced directives are legal documents that help you to voice your wishes regarding your future medical care should you become incapacitated due to illness or injury. Essentially, you're letting your medical providers know what care you would like to receive if you were to become in an accident and you couldn't make decisions for yourself. You're also going to be telling your medical providers who you would like to make decisions for you if you weren't able to make them for yourself. Advanced directives are really relatively simple documents to complete. Although they might seem overwhelming and daunting, Kansas makes it very easy for us to complete our documents by offering fill-in-the-blank statute forms. They're really simple to complete, and everyone can do it. So why do we need advanced directives? As a cognitively healthy person, you automatically have the right to decide what medical care and treatment you would like to receive. So what happens if you were to become unable to make those decisions for yourself? That's where your advanced directives come into play. You can make the decision of what medical care you would like to receive, as well as who you would like to make decisions for you before something happens and before you lose your capacity to do so for yourself. Many times family members equate this to a gift, and they say that having these directives done is a gift to the family members because then your family is not burdened with making those decisions for you. And if you haven't had these end-of-life decisions or discussions with your family members, many of them may not know what your wishes are. So that's why completing these forms can be a huge gift to your family members and friends. So who needs advanced directives? In Kansas, it's a relatively simple answer. Anyone over the age of 18 and who is cognitively competent to make their own decisions can complete an advanced directive. The first advanced healthcare planning document that we're going to be talking about today is the durable power of attorney for healthcare. That's the form where you're going to appoint someone to make medical decisions for you if you were to become incapacitated. They can make a lot of decisions for you, but you can also limit the decisions that they would make based upon your preferences. But generally in Kansas, this person is called your agent. That is just the legal term that Kansas uses to identify the person that's going to be making those decisions. The decisions that they can make for you typically include the medical treatment that you're going to receive, but also where and who is going to give you that treatment. So if you would prefer to go to a larger metropolitan hospital and receive care by one of the most world-renowned physicians, they can make that decision for you. Or if you'd rather stay in your hometown and receive care by your primary care physician, they can make that decision as well. They can also decide things like organ donation, autopsy, and what to do with your body after death. So if you haven't completed your cremation or burial plans yet, that individual can make those decisions for you. Your durable power of attorney also has access to your medical records. By signing that form and by being designated that agent, they have that right. However, it is also recommended that your durable power of attorney also complete a HIPAA privacy authorization form. This will allow them to have guaranteed access to your medical records as soon as a medical emergency arises. You can also designate anyone to have access to your medical records through your HIPAA privacy authorization form. We're going to talk more about the durable power of attorney for healthcare right after this break.
What a girl wants in her home kitchen. Ease of use, flexibility, fun, the latest kitchen design, Frigidaire professional real stainless steel for fewer finger smudges, a French door refrigerator, convection cooking, a quiet dishwasher. Have the staff at Genuine Appliance in Hayes demonstrate new Frigidaire professional appliances to find what you want. Genuine Appliance at 1224 East 27th in Hayes. Everything a girl wants.
Your home's exterior is the best defense against harsh weather conditions. With insulated vinyl siding, energy-efficient windows, spray foam insulation, and metal roofing from AquaShield Roofing and Construction, you can protect your home from howling winds and ice-cold temperatures. Don't let Mother Nature interfere with the comfort of your home. Call or visit us online today for a free estimate. AquaShield Roofing and Construction. Our team is dedicated to your complete satisfaction.
Hi?
We're looking for insurance.
Let's see who's free.
When insurance agents work for only one company, their options are simply limited. But a Trusted Choice independent agent is free to shop many companies for a better deal. Free to do what's right for you.
Let us shop for you. Contact Rogers & Associate to learn more.
Make a difficult choice an easy one with Cedar View Assisted Living's knowledgeable and caring staff. Your loved one will be professionally taken care of as they transition into their new community. With movies, holiday parties, planned exercises, and games, residents will have opportunities every day to enjoy their time at Cedar View. Multiple room styles are available, ensuring a just right fit for your loved one. Come see Cedar View Assisted Living for yourself next to Sternberg Museum. The care you need, the home you want.
Welcome back. I'm Dr. Erin Yelland for K-State Research and Extension, and today we're talking about advanced healthcare planning in Kansas. We're going to continue talking about the durable power of attorney for healthcare, specifically who you should appoint. First of all, there's some legal requirements as to who you can appoint as your agent in Kansas. That individual needs to be at least 18 years old, and they have to be cognitively competent. Other than that, there's very few restrictions. Other than that person cannot be your treating healthcare provider, so your primary care physician cannot be your durable power of attorney for healthcare. That individual cannot be an employee, owner, or director of your treating healthcare provider. So unless you have a sister, a brother, some sort of family member who is related to you by blood, marriage, or adoption, an individual who works for your treating healthcare provider cannot serve as your agent. So aside from those legal limitations, there are some considerations that you should make when you're thinking about who to appoint as your durable power of attorney for healthcare. First of all, that individual should be someone that you absolutely trust. That is an essential component to choosing someone to being your agent. That individual should also know you well, know what your wishes are, and be able to respect your wishes, even if they vary from their own. For example, if you wish to sustain your life on artificial nutrition and hydration, and if you would like to be put on life support, but your durable power of attorney for healthcare would not want that in their own life, it's essential that you make sure that they are going to honor your wishes and make the decisions that you would like them to make for you. So you might be wondering, how do you appoint an agent and how do you complete this process? Luckily, Kansas makes it very easy on us. They offer fill-in-the-blank statute forms that you can easily complete without the help of an attorney. You can access these forms through your local K-State Research and Extension office and fill them out for free. Essentially, you just have to put in your own information and the information about the person you would like to appoint as your agent. You have to sign and date the document and state that you're cognitively competent enough to understand what form you're completing. Other than that, you also need to receive the signatures of 2 witnesses, or you can have it notarized. So I'm often asked, what is the difference between the medical forms and the legal, more financial forms? That can be really confusing. So a durable power of attorney for healthcare is what we've been talking about today. That's that medical form where you're going to appoint someone to make those decisions for you on your behalf if you can't make them for yourself. You might also hear about durable or non-durable financial powers of attorney. And those are complex legal documents that require the assistance of an attorney to complete because they're dealing with your financial affairs. So it's always recommended that you utilize the services of an attorney to handle your financial affairs for when you would die. So we just finished talking about the durable power of attorney for healthcare. And the next form that we're going to talk about is your living will. A living will is essentially an instruction list to your family, friends, and medical providers about the type of care that you would like to receive at the end of your life. Generally, you're going to address things about whether or not you would like life-sustaining procedures at the end of your life. The Kansas statute form for a living will is essentially a request to die naturally, utilizing only comfort measures. Specifically, the living will states, I direct that such procedures be withheld or withdrawn, and that I be permitted to die naturally with only the administration of medication or the performance of any medical procedure deemed necessary to provide me with comfort care. So if you complete the Kansas statute living will form, that's what you're going to be signing, that you would not like to have any life-sustaining procedures at the end of your life with the exception of comfort care. So drugs like morphine will still be administered to you to allow you to die peacefully. There are some limitations with the living will that don't necessarily apply to your other advanced directives. A living will only become effective if you're deemed to have a terminal condition in writing by 2 physicians. So essentially, your living will not come into play unless you are absolutely going to die and you have that terminal diagnosis. There is another limitation with living wills, and that is if you were to become pregnant, your living will would no longer be effective. And that's because medical professionals can often sustain the life of a fetus even if the mother has a terminal condition. After we come back from the break, we're going to continue talking about living wills and then also discuss pre-hospital do not resuscitate orders.
Come on down to B's Bargains at Smith Center, Kansas. We got the deals.
We have a wide variety of inventory like soap, toiletries, toys, mini fridges, even kitchen tables.
Everything is new at B's Bargains, but it's all half the price. Yes, half price. That isn't just a good deal, that's a great deal.
And with new items daily, our inventory is constantly changing. That means new great deals are coming in by the truckload weekly.
B's Bargains at Smith Center. If you can't find a deal here, you can't find one anywhere.
Gove County Medical Center provides compassionate care combined with today's latest technology. We offer a wide range of services to meet the growing needs of you and your family, including surgical and swing bed services, cardiac and cancer rehab, as well as our pain clinic, long-term care, OB, and ongoing lactation assistance. Serving all of Northwest Kansas, our team of doctors and staff are committed to healing through caring. Visit govecountymedicalcenter.org and find us on Facebook to learn more.
Welcome back. I'm Dr. Erin Yelland for K-State Research and Extension, and today we're talking about advanced healthcare planning in Kansas. Specifically, I'd like to tell you about how to complete a living will. K-State Research and Extension offers free fill-in-the-blank forms that you can complete. So contact your local K-State Research and Extension office to get access to those forms, and they will give you guidance on how to complete them as well. In Kansas, a living will is essentially a fill-in-the-blank form where you can easily check the boxes and fill in your information and complete that form legally. It has to be signed and dated by yourself, and it also has to be signed by 2 witnesses, or it has to be notarized. I'm often asked, what's the difference between a living will, wills, and living trusts? So a living will is that medical document where you are directing what types of life-sustaining procedures you would like at the end of your life. A will and a living trust are those complex legal documents that have to do with your financial affairs. So if you would like to complete those documents, you will need to utilize the services of an attorney. I always like to share this little cartoon of Dilbert, where Dilbert and his little dog, Dogbert, are sharing the need to complete their advanced directives. So Dogbert says, here's the first draft of an advanced directive I wrote for you. It says, kill me if I'm itchy, kill me if I have a headache, kill me if I complain too much. And Dilbert says, I might have some edits. And Dogbert then says, there's your complaining again. So the moral of the story is, don't let your dog complete your advanced directives with you. But it's so important to make sure that those documents are completed. So far, we've talked about the durable power of attorney for healthcare and also the living will. But the last form that we're going to talk about is a pre-hospital DNR, or do not resuscitate order. A DNR is your written communication that you would like to have resuscitation not be attempted on you if you were to stop breathing or your heart were to stop beating. This is generally a document that is only for the terminally ill or the incredibly frail elderly. So most people watching this program would not need to complete a pre-hospital DNR. However, if you're in that situation or you know someone who is, K-State Research and Extension offers the form and can help you complete that form for you. Pre-hospital DNR is again a fill-in-the-blank form. Only this one has to be signed by yourself, but also your physician. So your physician has to determine that you're in the right state of mind to make that decision for you, and generally that your health is frail enough that a DNR is an appropriate choice for you. It also has to be signed by 1 witness, but other than that, they're very easy to complete. Now I'd like to share some final thoughts with you about advanced healthcare planning in Kansas. The first thing is to make sure that you are a registered organ donor if that is what you would like to choose for your own self. You can sign up numerous ways by going to donatelifekansas.com/join. You can also say yes at the DMV when you get your driver's license or renew it. Generally, they will ask you if you would like to be an organ donor when you go through that process. You can also call 1-888-744-4531 to request an organ donation form in Kansas. The next thing I'd like to talk about is appropriate storage of your documents, and the need to do so is highlighted adequately with this cartoon. It says they were sad when they found out their wealthy grandfather had died in an earthquake, but they were devastated when they discovered he had written his will on an Etch-a-Sketch. So you can see that appropriately storing your documents is crucial. You definitely don't want to be writing things on an Etch-a-Sketch and living in a place where you might have earthquakes. Places that you should be storing your documents include your home, your vehicle, any place that you visit for long periods of time, with your family and your close friends, with your physician and at your local hospital, as well as with your healthcare agent, that person that you've appointed to make medical decisions for you if you were to become incapacitated. In your home and in your vehicle, you should always put your document in an accessible place where someone can find it. Putting it in a filing cabinet or in a locked drawer is not a very good option. Putting it on your refrigerator or in your glove box, those are appropriate choices where people will often look for these types of documents. One of the most important things to remember, though, is that a safety deposit box is not an appropriate place. Oftentimes when we think about those important forms in our life and we want to keep them safe, that's automatically where we put them. But think about who can access that safety deposit box if you were to be in an accident. Really, it's you or your spouse. And the last place that your spouse needs to be during a medical emergency is at the bank trying to get into your safety deposit box to access those necessary forms. So it's really important that you appropriately store those documents and have them accessible. One of the other ways that you can have the form accessible is by filling out a wallet card and keeping that information in your wallet. On that wallet card, you can put in your name, your healthcare agent's name, and their contact information so that your forms can be easily identified. And K-State Research and Extension offers these wallet cards for you. So go to your local extension office, get access to the wallet cards, and make sure that your documents are accessible. For more information about advanced healthcare planning in Kansas or any other question or issue that comes up in your life, contact your local K-State Research and Extension office. K-State Research and Extension is dedicated to serving local Kansas communities by bringing research-based information generated at Kansas State University and other universities across the country out to your local Kansas communities.